1. Your patient is a 27-year-old male who has fallen from a 24-foot ladder. As you are approaching and forming your general impression, you note that he is conscious and talking. What should you do first? A. Look at his chest to begin assessing the airway. B. Manually stabilize his neck in a neutral position. C. Palpate for a radial pulse in an uninjured arm. D. Palpate for a carotid pulse on one side of his neck. Answer. B. The airway is always given first priority, but in this case, since the patient is talking, the first step in his assessment and care would be to stabilize the cervical spine as you begin your ABC assessment. 2. In a motor vehicle crash, which of the following would be most important to understand in relation to the force of collision and the potential for injury? A. Speed at time of impact. B. Weight of the vehicle. C. Road conditions at the scene. D. Condition of the vehicle's tires. Answer. A. Kinetic energy equals mass, weight, times velocity, speed, superscript 2/2. This means that speed plays a greater role in the force changes during a motor vehicle crash. While the other items are important when evaluating an accident scene, speed has the greatest influence on the potential for damage and injury. 3. You note snoring sounds during your initial assessment of a semiconscious trauma patient. What is your next step? A. Manually stabilize the cervical spine. B. Perform the chin lift/jaw thrust maneuver. C. Perform the head tilt/chin lift maneuver. D. Measure and insert an oropharyngeal airway. Answer. B. Snoring indicates that the airway is partially obstructed by the patient's tongue. Clear the airway, first by positioning with the chin lift/jaw thrust maneuver or by inserting a nasopharyngeal airway. An oropharyngeal airway is not indicated due to the patient's LOC, cervical stabilization, takes place prior to beginning your ABC assessment, and head tilt/chin lift is not advisable due to the possibility of C-spine injury. 4. A patient with left shoulder pain may have A. Bowel obstruction. B. Pelvic fracture. C. Pneumothorax. D. Ruptured spleen. Answer. D. Bleeding within the abdominal cavity can irritate the abdominal surface of the diaphragm, causing referred pain to the shoulder. 5. With the START triage method, several vital signs are quickly assessed to determine the order to care for and transport patients. According to the START method, which of the following patients would receive immediate treatment to support hemodynamic status without further assessment? A. Male, radial pulse present, skin warm and dry. B. Female, radial pulse present, capillary refill time 1 second. C. Male, radial pulse present, skin pale and cyanotic. D. Female, radial pulse present, capillary refill time 0.5 seconds. Answer. C. The START method quickly reviews 3 categories to determine patient priority: respirations, pulse, and mental status. After respiratory status is assessed, the basis for judging a patient's hemodynamic status is the presence or absence of a radial pulse or skin color and temperature. This patient is showing signs of shock. 6. A patient in compensatory hemorrhagic shock would most likely present with which set of vital signs? A. Pulse 120 and BP 122/86 mmHg. B. Pulse 80 and BP 118/70 mmHg. C. Pulse 64 and BP 72/50 mmHg. D. Pulse 58 and BP 212/120 mmHg. Answer. A. By definition, compensatory shock means that in the presence of a hypoperfusing state, the body maintains its blood pressure to the brain. One way to maintain this condition is to increase heart rate. Choice satisfies both of these conditions. 7. A patient has fallen off a 20-foot ladder, striking his back on a railing. He is experiencing pain at the injury site and a loss of bladder control. Which part of the spinal cord is most likely affected by this mechanism? A. Coccyx. B. Cervical. C. Sacral. D. Lumbar. Answer. C. Nerves that assist in bladder control exit from the sacral spine, located above the coccyx. 8. An unrestrained driver of a small car struck a tree at high speed. He has a distended abdomen that is tender when palpated. Vital signs are pulse, 120 beats per minute, respirations, 20 per minute, and blood pressure, 116/90 mmHg. What would be the most likely cause of the abdominal tenderness? A. Bacterial peritonitis. B. Abdominal muscle strain. C. Organ damage. D. Seatbelt injury. Answer. C. Organ damage from the mechanism of injury may result in inflammation and bleeding, resulting in the compensatory vital signs. 9. Where would you expect to see a wound that is described as distal to the knee? A. Hip. B. Stomach. C. Thigh. D. Calf. Answer. D. Distal refers to a location that is further from the trunk of the body than the reference point. Answer questions 10 to 13 on the basis of the following information. You respond to a 63-year-old male who is complaining of sudden onset of extreme substernal chest pain that, he says, feels like my insides are tearing. The patient states that the pain radiates to the middle of his back between his shoulder blades. 10. You respond to a 63-year-old male who is complaining of sudden onset of extreme substernal chest pain that, he says, feels like my insides are tearing. The patient states that the pain radiates to the middle of his back between his shoulder blades. Which condition is this patient most likely suffering from? A. Dissecting aortic aneurysm. B. Abdominal aortic aneurysm. C. Acute arterial occlusion. D. Acute pulmonary embolism. Answer. A. This patient is exhibiting classic signs and symptoms for a dissecting aortic aneurysm. The tearing sensation occurs as the intimal linings of the aorta are separated as blood collects between the tissues. 11. Which of the following is a predisposing factor for this patient's condition? A. Hypotension. B. Hypertension. C. Angina pectoris. D. Myocardial infarction. Answer. B. Hypertension is present in 75 to 85% of dissecting aortic aneurysm cases. 12. Which of the following medications may be ordered by medical control to treat this patient? A. Dopamine. B. Atropine sulfate. C. Morphine sulfate. D. Isoproterenol. Answer. C. Morphine sulfate is the appropriate medication for this patient. Medications that increase cardiac rate, output, function, or contractile force are contraindicated while the dissection is occurring. 13. Progression of this condition may cause A. Stroke, pericardial tamponade, acute myocardial infarction. B. Acute arterial occlusion, acute pulmonary embolism, encephalitis. C. Deep venous thrombosis, varicose veins, arterial atherosclerotic disease. D. Arterial atherosclerotic disease, pulmonary embolism, acute arterial occlusion. Answer. A. These are all consequences of further dissection. Other conditions also include syncope, heart failure, and absent or reduced pulses and death. 14. Your patient has survived a vehicle rollover in which another passenger in the vehicle died. He is alert and not complaining of pain. His vital signs are pulse 100, systolic BP 90, respirations 28. What additional procedures are required prior to initiating transport? A. Complete a detailed physical exam and stabilize his injuries, and then transport. B. Quickly immobilize him using the long backboard as a splint, and then transport. C. Perform a focused physical exam, splint all extremity fractures, and then transport. D. Immobilize first, complete a focused physical exam of any injuries, and then transport. Answer. B. Even though the patient's condition appears to be stable, the mechanism of injury indicates that serious underlying injuries, such as internal bleeding, may be present. Immobilize him quickly using the long board as a full-body splint. Transport immediately in this case. You can perform additional assessments or treatments while en route. 15. Which statement about motorcycle crashes is correct? A. They seldom result in severe trauma, unless the motorcycle is operated at high speeds. B. Helmet use can reduce the incidence and severity of head injury. C. Helmet use can reduce the incidence and severity of spinal injury. D. Leather clothing cannot protect the rider against soft tissue injury. Answer. C. Use of a helmet can protect the rider against head injury, but not against spinal injury. Leather clothing is helpful in reducing the amount of soft tissue injury. Because the energy of the accident is mostly absorbed into the rider, severe trauma is noted even with low-speed crashes. 16. What is a positive battle sign an indication of? A. Basilar skull fracture. B. Orbital skull fracture. C. Cranial nerve injury. D. Retinal hemorrhage. Answer: a battle sign is an ecchymotic area behind the ear that is associated with a basilar skull fracture. 17. A contractile contusion is a brain injury that A. results from cerebral edema at the site of impact. B. Causes subdural or epidural hematoma formation. C. Is on the opposite side of the head from the impact site. D. Results from open skull fracture and brain bruising. Answer: C. A contractile injury is an injury to the brain opposite the impact site. It results from the brain's rebounding movement against the skull wall following the initial impact. The Q injury is noted at the site of the actual impact. 18. Your patient is a car crash victim who was unconscious prior to your arrival, but is now awake. As you examine the patient, you notice that he is becoming disoriented. What should you suspect? A. Basilar skull fracture. B. Epidural hematoma formation. C. Concussion with awakening. D. Inner ear injury. Answer: B. The symptoms are indicative of a mass-forming lesion in the head, such as an epidural or subdural hematoma. When a patient has a simple concussion, his or her mental status will continue to improve with time. 19. Your trauma patient opens her eyes, pulls her hand away when pinched, and speaks only in garbled sounds. What is her Glasgow Coma Scale score? A. 5. B. 7. C. 9. D. 11. Answer: C. The score is 9. 2 points for eye opening, 5 points for motor response, and 2 points for speech. 20. Your trauma patient is agitated and apprehensive. She is increasingly cyanotic, and breath sounds are rapidly diminishing over her left lung. She is exhibiting signs and symptoms of shock. You should suspect: A. Hemothorax. B. Tension pneumothorax. C. Cardiac tamponade. D. Flail chest. Answer: B. The signs and symptoms of tension pneumothorax are given.